Welcome to my channel. This is Dr. Rashid. Today we will discuss about asthma in detail. We will discuss symptoms and causes of asthma, and diagnostic and test, management and treatment, prevention, prognosis, etc. What is asthma? Bronchial asthma or asthma is a lung disease. Your airways get narrow and swollen and are blocked by excess mucus. Medications can treat these symptoms. First of all, we have to know what is asthma. Asthma, also called bronchial asthma, is a disease that affects your lungs. It's a chronic condition or ongoing condition, meaning it doesn't go away and needs ongoing medical management. Asthma affects more than 25 million people in the US currently. This total includes more than 5 million children. Asthma can be life-threatening if you don't get treatment. What is asthma attack? When you breathe normally, muscles around your airways are relaxed, letting air move easily and quietly. During an asthma attack, three things can happen. First one, bronchospasm. The muscles around the airways constrict or tighten. When they tighten, it makes your airways narrow. Air cannot flow freely through constricted airways. Second one could be inflammation. The lining of your airways becomes swollen. Swollen airways don't let as much air in or out of your lungs. Mucus production. During the attack, your body creates more mucus. This thick mucus clogs airways. When your airways get tighter, you make a sound called wheezing. When you breathe, a noise your airways make when you breathe out. You might also hear an asthma attack called an exacerbation or a flare-up. It is the term for when your asthma is in control. What type of asthma are there? Asthma is broken down into types based on the cause and the severity of symptoms. Healthcare providers identify asthma as intermittent and persistent. Intermittent, this type of asthma comes and goes, so you can feel normal in between asthma flares. Persistent. Persistent asthma means you have symptoms much of the time. Symptoms can be mild, moderate, or severe. Healthcare providers base asthma severity on how often you have symptoms. They also consider how well you can do things during an attack. Asthma has multiple causes. One of the causes is allergen. Some people's allergies can cause an asthma attack. Allergens include things like molds, pollens, and pet dander. Non-allergic outside factors can cause asthma to flare up. Exercise, stress, illness, and weather may cause a flare. Asthma can also be adult onset, pediatric. Adult onset, this type of asthma starts after the age of 18, pediatric. Also called childhood asthma, this type of asthma often begins before the age of 5 and can occur in infants and toddlers. Children may outgrow asthma. You should make sure that you discuss it with your healthcare provider before you decide whether your child needs to have an inhaler available in case they have an asthma attack. Your child's healthcare provider can help you understand the risk. In addition, there are three types of asthma: exercise-induced asthma, occupational asthma, asthma COPD overlap syndrome. Exercise-induced asthma. This type is triggered by exercise and is also called exercise-induced bronchospasm. Occupational asthma. This type of asthma happens primarily to people who work around irritating substances. Asthma COPD overlap syndrome ACOS. This type happens when you have both asthma and chronic obstructive pulmonary disease or COPD. Both diseases make it difficult to breathe. Who can get asthma? Anyone can develop asthma at any age. People with allergies or people exposed to tobacco smoke are more likely to develop asthma. This includes secondhand smoke, exposure to someone else who is smoking, and third-hand smoke, exposure to clothing or surfaces in places where some has smoked. Statistics show that people assigned female at birth tend to have asthma more than people assigned male at birth. Asthma affects black people more frequently than other races. What are the symptoms and causes? What causes asthma? Researchers researchers don't know why some people have asthma while others don't, but certain factors present a higher risk. Allergies. Having allergies can raise your risk of developing asthma. Environmental factors. People can develop asthma after exposure to things that irritate the airways. These substances include allergens, toxins, fumes, and second or third hand smoke. This can be especially harmful to infants and young children whose immune system haven't finished developing. Genetics. If your family has a history of asthma or allergic diseases, you have a higher risk of developing the disease. Respiratory infections. Certain respiratory infections, such as respiratory syncytial virus (RSV), can damage young children's developing lungs. What are common asthma attack triggers? You can have an asthma attack if you come in contact with substances that irritate you. Healthcare providers call these substances triggers. Knowing what triggers your asthma makes it easier to avoid asthma attacks. For some people, a trigger can bring on an attack right away. For other people, or at other times, an attack may start hours or days later. Triggers can be different from each person, but some common triggers include air pollution. Many things outside can cause an asthma attack. Air pollution includes factory emissions, car exhaust, wildfire smoke, and more. Dust mites. You can't see these bugs, but they are in our homes. If you have a dust mite allergy, this can cause an asthma attack. Exercise. For some people, exercising can cause an attack. Mold. Damp places can spawn mold, which can cause problems if you have asthma. You don't even have to be allergic to mold to have an attack. Pest. Cockroaches, mice, and other household pests can cause asthma attacks. Pets. Your pets can cause asthma attacks if you are allergic to pet dander, dried skin flakes of pet. Breathing in the dander can irritate your airways. Tobacco smoke. If you or someone in your home smokes, you have a high risk of developing asthma. You should never smoke in enclosed places like the car or home, and the best solution is to quit smoking. Strong chemicals or smells. These things can trigger attacks in some people. Certain occupational exposures. You can be exposed to many things at your job, including cleaning product, dust from floor or wood, or other chemicals. This can all be triggers if you have asthma. What are the signs and symptoms of asthma? People with asthma usually have obvious symptoms. These signs and symptoms resemble many respiratory infections: chest tightness, pain, or pressure, coughing, especially at night, shortness of breath, and wheezing. With asthma, you may not have all of these symptoms with every flare. You can have different symptoms and signs at different times with chronic asthma. Also, symptoms can change between asthma attacks. Diagnosis and test. How do healthcare providers diagnose asthma? Your healthcare provider will review your medical history, including information about your parents and siblings. Your provider will also ask you about your symptoms. Your provider will need to know any history of allergies, eczema, and other lung diseases. Your provider or doctor may order spirometry. This test measures airflow through your lungs and used to diagnose and monitor your progress with treatment. Your healthcare provider may order a chest x-ray, blood test or skin test. Management and treatment of asthma. What asthma treatment options are there? You have options to help manage your asthma. Your healthcare provider may prescribe medications to control symptoms. These include bronchodilators. This medicine relax the muscles around your airways. The relaxed muscles let the airways move air. They also let mucus move more easily through the airways. These medicines relieve your symptoms when they happen and are used for intermittent and chronic asthma. Anti-inflammatory medicines. These medicines reduce swelling and mucus production in your airways. They make it easier for air to enter and exit your lungs. Your doctor may prescribe them to take every day to control or prevent your symptoms of chronic asthma. Biologic therapies for asthma. These are used for severe asthma when symptoms persist despite proper inhaler therapy. You can take asthma medicines in several different ways. You may breathe in the medicines using a metered dose inhaler, nebulizer, or another type of asthma inhaler. Your doctor may prescribe oral medications that you swallow. What is asthma control? The goal of asthma treatment is to control symptoms. Asthma control means you can do the things you want to do at work and home. Have no asthma symptoms, rarely need to use your reliever medicine, rescue inhaler. Sleep without asthma interrupting your rest. How do you monitor asthma symptoms? You should keep track of your asthma symptoms. It's an important piece of managing the disease. Your healthcare provider may ask to use a peak flow meter or PF meter. This device measures how fast you can blow air out of your lungs. It can help you your provider or doctor make adjustment to your medications. It also tells you if your symptoms are getting worse. What are the prevention of asthma? How can anyone prevent an asthma attack? If your doctor says you have asthma, you will need to figure out what triggers an attack. Avoiding the triggers can help you avoid an attack. You can't prevent yourself from getting asthma though. What are the outlook for someone with asthma? If you have asthma, you can still live a very productive life and participate in sports and other activities. Your doctor can help you manage symptoms, learn your triggers, and prevent or manage attacks. What is asthma action plan? Your doctors will work with you to develop an asthma action plan. This plan tells you how and when to use your medicines. It also tells you what to do based on your asthma symptoms and when to seek emergency care. What should anyone do if you have a severe asthma attack? If you have a severe asthma attack, you need to get immediate medical care. The first thing you should do is use your rescue inhaler. A rescue inhaler uses fast-acting medicine to open up your airways. It's different than a maintenance inhaler which you use every day. You should use the rescue inhaler when symptoms are bothering you, and you can use it more frequently if your flare is severe. If your rescue inhaler doesn't help or if you don't have it with you, go to the emergency department of the hospital. If you have anxiety or panic, bluish fingernails, bluish lips, or grey or whitish lips or gums, chest pain or pressure, coughing that won't stop or severe wheezing when you breathe, difficulty talking, pale sweaty face, very quick or rapid breathing. How do you know if do or don't have asthma? You will need to see a doctor to find out if you have asthma or some other conditions. There are other respiratory diseases that make it hard to breathe or cause coughing and wheezing. Can asthma be cured? No, asthma can be cured, but it can be managed. Children may outgrow asthma as they get older. Why is someone's asthma get worse at night? Asthma that gets worse at night is sometimes called nighttime asthma or nocturnal asthma. There are no definite reasons that this happens, but there are some educated guesses. These include the way you sleep. Sleeping on your back can result in mucus dripping into your throat or acid reflux coming back up from your stomach. Also, sleeping on your back puts pressure on your chest and lungs, which makes breathing more difficult. However, lying face down or on your side can put pressure on your lungs. Triggers in your bedroom and triggers that happened in the evening. You may find your blankets, sheets, and pillows have dust mites, mold, or pet hair on them. If you have been outside in the early evening, you may have brought pollen in with you. Medication side effects. Some drugs that treat asthma, such as steroids and montelukast, can affect your sleep. Air that's too hot or too cold. Hot air can cause airways to narrow when you breathe in. Cold air is an asthma trigger for some people. Lung function changes. Lung function lessens at night as a natural process. Asthma is poorly controlled during the day. Symptoms that are not controlled during the day won't be better at night. It's important to work with your doctor to make sure your asthma symptoms are controlled both day and night. Treating nighttime symptoms is very important. Serious asthma attacks and sometimes death can happen at night. So, thank you. If you like our video, then subscribe to our channel. Thank you all.